My name is Hannah. I'm an exercise specialist in the Rush Cancer Center. Since we're talking about ostomy awareness this week, I thought it would be a great opportunity to talk about safe core exercises that can be done following abdominal surgery, just because one of the main complications following abdominal surgeries and following any type of ostomy or stoma is increased risk of hernias. So individuals find that they often have a weakened core, which increases their risk of hernia. So we can do safe core exercises, and I want to walk you through them, where to start, what to focus on, in hopes of engaging that core. And when I'm talking about core, I'm not talking about six-pack abs. I'm talking about that lower core, those muscles that help you cough, so that deep core muscle that really helps maintain a solid foundation. Additionally, something to keep in mind before exercising is one, getting clearance from your surgeon. You want to make sure that you're exercising in a safe manner, and you want to make sure that you're healed appropriately following your surgery. And then two, emptying your ostomy bag if you do have an ostomy. We don't want any of these exercises to increase the risk of dislodgement, so just make sure it's empty and ready to go before you start exercising. All right, let's get going. So for all of these exercises, we're going to be starting in a laying down position. So you'll be laying down on your back, your head is going to be on the ground, and your legs will be at 90 degrees, about hip width apart. Okay, so we're going to slowly lower on back. We're going to have a straight spine. Your head is going to be on the ground, because when you lift your head, that engages your six-pack core, and that's not what we want to focus on today. We want to focus on the lower core. So we're going to keep our head on the ground. We're going to keep a neutral spine, so ideally not having a big arch in your back, just having a nice neutral spine. The first movement, you want to make a diamond with your hands, and you're going to put your thumbs kind of at your belly button, and then your pointing fingers are going to point down towards your pelvis, and then your the sides of your hands are going to rest on your pelvic bone right here, okay? So you're going to make this triangle on your lower core. This movement is our standard entry movement. We're going to be progressing as we go. The first one will be the easiest, but it may not be easy following your surgery, okay? So we're here, all we're doing is we are inhaling through our nose and exhaling through our mouths. On the exhale, I want you to squeeze and engage that lower pelvis, and then relax on your inhale. On your exhale, again, squeeze that pelvic muscle, this lower muscle here. A good way to know if you're squeezing the right muscle is if you cough and you feel that muscle tighten. That's what you want to be mimicking. So again, in through the nose, out through the mouth, and squeeze that lower core, and then relax. Squeeze on the exhale, relax on the inhale. Last one. Squeeze on the exhale, relax on the inhale. Good. So again, we are engaging this lower core muscle. Once you're comfortably doing that, we can advance to the next move, okay? This next move, again, we're starting in our standard position, and what we're going to be focusing on this time is taking our pelvic bone and pushing it up. So we're going to shift our pelvis, which will place our lower back on the ground, okay? So it's going to be right here. So we're starting in our neutral position. Our pelvis is going to flip, or it's going to turn, which is going to push our lower back into the ground. We're going to hold for a few seconds and lower it back down. But you don't want to lift your head like I've been doing, okay? So now we'll try this again. Shift your pelvis up, push that lower back down. We're going to hold it, and then we're going to lift it back up. Good. We're going to do this 2 more times. Pushing that pelvis up, back down, hold it. Good. Last one. Shift that pelvis up. We're going to hold this one for 3, 2, 1. Good. So the goal with this one is ideally down the road you'll be able to do about 20 or so in a row. All right, so this next one, if you can have like a sock or maybe a towel on the ground, it will make it a smoother move. But what we're going to be doing this time is we're going to be taking one of our legs. So I'll start with the right leg, and I'm going to take my toes and point them to the ceiling, and my heel is going to be on the ground. This movement, we are going to slide our heel down and then slide it back up. Good. It's right here. We're going to do 10 on each side. If you were to have a sock on, or if you were to put a towel, you wouldn't get the snag that I'm getting right now. So this is 3. it'd be a smoother movement. 4, good. 5, 6, 7, 8, 2 more, 9, last one, 10. Good, and you would ideally repeat on both sides. For the sake of time today, we'll just do the right leg. And then the last move, the most difficult move in this series today, will be what we like to call a bridge position. So you'll be again in our starting position, shoulders on the ground in a neutral spine. You're going to engage your core. So like you did with your first exercise, you're going to squeeze those bones by your pelvic bone, or that muscle by your pelvic bone right here. And then to take it up a notch, we're going to lift your glute off the ground. Good, all the way until you hit a straight position. Good, you're going to hold that and you're going to slowly lower it down one vertebrae at a time. Good. Okay, when we do this again, we start by engaging that lower core. Good. And then we're going to lift till straight. Hold for 3, 2, 1. Lower it back down. All right, and then last one. Bring it up. Good. Squeeze in that lower core. 3, 2, 1. Lower it back down. All right, so those are 4 core exercises that can be really wonderful to incorporate into your exercise routine to strengthen your abdominal wall and prevent your risk of hernias. So it really is important to continue to have a strong core even if you have a stoma. If you have any questions or concerns, feel free to reach out to me. I'm happy to talk through anyone's exercise questions. Have a great day. Thank you.